First veterinary college in the world was established in Lyon, Lyon city of France. Father of veterinary science in India is Salihotra. India related question. Each year World Veterinary Day is celebrated on last Saturday of April. April the fourth month of English calendar. Recently, SARS-CoV-2 was found in which of these animals in Hong Kong and USA respectively? Dog and tiger has been reported to be infected with SARS-CoV-2 virus in Hong Kong and USA. Hong Kong has report of dog and USA reported the infection of tiger. Which animal is unable to fart? Kangaroo. Kangaroo is unable to fart. Which from what noun name veterinary is derived and what does it mean? It is derived from Vacca, that means cow. Veterinary world is derived from Vacca, that means cow, and vaccination is also derived from Vacca, that means cow. I'm not sure for Vacca for vaccination, but veterinary is derived from VACC, Vacca, that means cow. A popular veterinarian known as Elephant Man of Asia has been selected for prestigious Padma Shri Award 2002. He is Dr. K.K. Sharma. Indian related question. Identify the species shown in the photograph below. This is the mitten. It is the photoshoped animal. In which year World Veterinary Day was instigated by World Veterinary Association? In 2001. In 2001, World Veterinary Day was instigated by World Veterinary Association. First scientific research in artificial insemination was performed on dog. Who is the only veterinarian to have won Nobel Prize in Medicine? Peter Doherty. Peter Doherty is the only veterinarian who is the Nobel Prize winner. First veterinary college in India was in Bombay. Which pet animal are born blind? Rabbit is born blind. There is no cat, dog. Indian Veterinary Council Act was in 1989. In 1984 and 1996 or 1994, Pakistan Veterinary Medical Council was established. Emergency animal helpline number is 1962. Emergency animal helpline number. Indian related question. Veterinary license examination for abroad is both of above as National Veterinary Examination NVE and National Veterinary Licensing Examination NAVLE. NVE and NAVLE, also known as NAVLE. World Environment Day is 5th June. January, February, March, April, May, June. 6th month. 5th day of 6th month is the World Environment Day. Vet techs can perform which of the following? Veterinary technicians can perform surgical assisting. Veterinary astronaut are both of above as Richard M. Linehan and Martin Fatman. Martin Fatman and Richard M. Linehan are the veterinary astronauts. The study of animal behavior is called as ethology. Which animal can never sleep? Bulldog never sleeps. The latest 20th livestock census related released 1 year of 2019 Indian related question. Fat percentage and solid knot percentage of pasteurized milk of Amul Gold is fat percentage and SNF 3% fat and 8.5% solid knot fat is in Amul Gold. When world was officially declared free from rinderpest by OIE in 2000, the world was officially declared free from rinderpest. Which animal has longest period of pregnancy? Elephant, and the duration of pregnancy is of 2 years in elephant. First in vitro fertilization in buffalo developed by an NDRI is the Pratham was the first AI developed by NDRI. An administrative and operational branch of Indian Army for Veterinarian is RVC, Royal Veterinary Corps, I think. Latest MSVE, minimum standards for veterinary education, as per new VCI released in 2016. Indian related question: in which year 250th anniversary of veterinary profession declared as World Veterinary Year in 2011? 2011 was the 250th veterinary professional anniversary and it was the World Veterinary Year. Deemed veterinary university in India is both UVAS as IVRI and NDRI. The most dangerous animal of all the species that veterinary personnel are asked to restrain is the dairy bull. Dairy bull is the most difficultly to be restrained. Silver revolution for egg. Last year theme of World Veterinary Day 2019 was value of vaccination. Prime Minister will launch National Disease Eradication Control Program for disease of FMD and brucellosis, which is the only state lab in India to study first genome sequencing of SARS-CoV no COVID virus 2. It is the Gujarat Biotechnology Research Center. Seventh day weight of broiler should be 4 times that of the day-old weight. It should be the 4 times. So it means that if the day-old chick is of 30 gram, then at 7th day it should have to be of 4 3s or 12 120 gram. Or in by thumb rule, the bird should have to gain 50 gram weight per day. 7th day should have the 4 times that of weight of the day old chick. All are brooding requirements except vaccination. Material used for fumigation of poultry farm are formalin and potassium permanganate. Never maintain the temperature at the cost of ventilation. The method to increase the production lifespan of layer is molting. Energy requirement for starter phase of broiler ranges from 3000 to 3200 kilocalories. How the egg size of a layer can be managed by all of these as genetics, nutrition, body weight and maturity, and rate of maturity. Disease transmitted within the flock due to close contacts is do not know. It should be do not know. Optimum elevation level of hatchery should be 3000 feet square above the sea level. Optimum elevation level for hatchery should be 3000 feet square above sea level. Most critical to hatchery performance is the equipment selection. Ideal height for egg room in hatchery is 12 feet. The front of a setter should have the space at least 10 to 12 feet from the front of the setter. The front of setter should have the space at least 10 to 12 feet from the front of other setter. The different distance between two setters should have to be between 10 to 12 feet. For getting optimum production, hatchability and fertility, body weight of male at age of 24 weeks should be 30 times heavier than the female. For getting optimum production, hatchability and fertility, body weight of the male at age 24 should be 30 times heavier than that of the females. Optimum number of chicks from meat type breeder is 140. Chicks are the most important species for generating income for rural families. Regarding the factor, chicks are waste converters. Male chicken is known as cock. Meat type breed is do not know. All are characteristics of local breed asil except do not know. Animal products technology quiz. Heating the raw milk at high enough temperature for sufficient time to remove pathogen and increase shelf life for more than a month, less than a month, is called as pasteurization. Starter culture mostly used for yogurt making is Lactobacillus bulgaricus. Fat-free milk is also known as the skim milk. Milk with 1% fat is also known as light milk. The souring process of milk is also known as acidification. Milk lipid component of cows. Major lipid component of cow's milk is triglycerides. Serum protein is also known as whey protein. All are the processes of milk fractionation except pasteurization. The process of milk fractionation comprises of centrifugation, membrane separation, ion exchange, and precipitation. But pasteurization is not the process of milk fractionation. Colostrum milk is not suited for ultra heat treatment because it has more serum proteins. Fresh meat should be frozen at between -29 to -40 degrees centigrade. A point, step, or procedure in food processes at which control can be applied and as a result a food safety hazard can be prevented is critical control point. Fibrous protein found in bones, teeth, and connective tissue of animal is collagen. Collagen is the fibrous protein found in bones, teeth, and connective tissue of animal. Fat obtained from halal animal is called tallow. Tallow is the fat obtained from halal animals. Hydrolysis of collagen proteins result in the formation of gelatin. Hydrolysis of collagen proteins results gelatin. Which of the following meat has less marbling? Chicken has the less marbling. The sauce made of oil and other species. The sauce made of oil and other spices in which meat is soaked before cooking to flavor. It is called marinade. Marinade is a sauce made of oil and other spices in which meat is soaked before cooking to flavor it. It is marinade. Common animal fiber is silk. Technique most efficient for distinguishing of different fibers is infrared spectrophotometry. It is a technique for efficient distinguishing between different fibers. The wool that is removed from dead sheep skin by rubbing the back of skin with acid or lime is called pulled wool. Pulled wool is the wool that is removed from dead sheep skin by rubbing the back of skin with acid or lime. Veterinary physiology. Which of the following type of cell constitutes 2 to 8% of total leukocytes? Eosinophil consists 2 to 8% of total leukocytes. Segmented nucleus with 3 to 5 lobes is present in neutrophils. The most numerous leukocytes in ruminants is lymphocytes. The largest cell of the leukocyte is monocyte. Cytoplasmic chunks of megakaryocytes are monocytes. Cytoplasmic chunks of megakaryocytes are platelets. Platelets are the cytoplasmic chunks of megakaryocytes. Blood is a system. The blood is not a system, blood is a tissue. Blood is a tissue. Major natural progestin is progesterone. Progesterone is a major natural progestin. The following substances are considered to be referred as eicosanoids. All of above as prostaglandins, leukotrienes, thromboxanes, they are referred as eicosanoids. Which of the following glucocorticoids is a short to medium acting drug? Prednisolone is a glucocorticoid and is short to medium acting drug. Biotransformation of medicinal substances results in faster urinary excretion. Conjugation is coupling of drug with an endogenous substrate. Which of the following processes proceeds in the second phase of biotransformation? Acetylation is the process that proceeds in the second phase of biotransformation, or acetylation is in the second phase of biotransformation. Conjugation of a drug includes all of the following except hydrolysis. Conjugation of drug includes glucocoordination, it includes sulfate formation. Conjugation of drug includes methylation. Conjugation of drug includes acetylation, but the conjugation of drug do not include hydrolysis. In summary, conjugation of drug considers or has the glucuronation, sulfate formation, methylation, acetylation, but not hydrolysis. Which of the following drug type is the most prominent for microsomal oxidation? Lipid soluble drug type is the most prominent for microsomal oxidation. Biotransformation of a drug is to render them biological barriers include all except renal tubules. Renal tubules are not the biological barriers, but whereas the biological barrier comprises of cell membrane, capillary walls, placenta and brain. Renal tubules are not the biological barriers. Which area of the brain is most directly involved in the reflex control of autonomic system? Medulla oblongata. Medulla oblongata is the part of the brain that is mostly directly involved in the reflex control of autonomic nervous system, or medulla oblongata controls the reflex. Which of the following is true about the precentral gyrus? Precentral gyrus, both A and C are true, as precentral gyrus is involved in motor control and precentral gyrus is located in frontal lobe, or the precentral gyrus is located in frontal lobe, and it controls the it is the motor control. In a skin knee jerk reflex, how many synapses are activated? In a single knee jerk reflex, how many synapses are activated within the spinal cord? Only one. Only one synapse is activated within the spinal cord in a single knee jerk reflex. Which of the following muscles have motor units with highest innervation ratio? Muscles that move the fingers. Muscles that moves the fingers has the motor units with highest innervation ratio. In most animals, the right hemisphere of cerebrum controls the movement of the left side of the body. All of the following are local hormones except renin. Renin is not a local hormone, whereas the local hormones comprises of acetylcholine, secretin, and cyto and cholecystokinin. Cholecystokinin, secretin, and acetylcholine are the local hormones, whereas renin is not a local hormone. Cutaneous receptive fields are smallest in the digits. The digits has the smallest cutaneous receptive fields. Epithelial cells release transmitter chemicals that excite sensory neurons in all of the following except smell. In smell, the epithelial cells release transmitter chemicals that excite sensory neurons. Which of the following hormones is produced by a hypothalamic gland? Growth hormone, releasing hormone, GHRH. Growth hormone releasing hormone is the hormone that is produced by hypothalamic gland or hypothalamus, or hypothalamic gland secretes growth hormone releasing hormone. I think it is GnRH. Which of the following hormones is produced by the anterior lobe of the pituitary? Growth hormone, somatotropin or GH is released from the anterior lobe of the pituitary. The posterior pituitary does not secrete growth hormone. Which of the following organs and the posterior pituitary is involved in the secretion of vasopressin, oxytocin? Oxytocin and vasopressin both are secreted from the posterior pituitary, whereas growth hormone is not secreted from the posterior pituitary. Which of the following organs is a target for prolactin? The organ that is target for prolactin is the mammary gland. Which of the following organ hormones is a target for growth hormone or somatotropin? The target of somatotropin is the IGF, insulin-like growth factors. Insulin-like growth factors is the target of gonad or somatotropin, that is growth hormone. All of the following statements about growth hormone are true except hypersecretion can result in acromegaly. It is not true that hypersecretion can result in acromegaly, whereas the following statement about growth hormones are true, that are it may stimulate growth hormone may stimulate the synthesis or release of somatomedins. Low level of insulin like growth factors are associated with dwarfism. Growth hormone low levels of insulin like growth factors are associated with dwarfism. Hypersecretion of growth hormone can result in acromegaly. It is false. Hypersecretion of growth hormone can never result acromegaly, and it is true that growth hormone is contraindicated in subjects with closed epiphysis. The phenomenon of osmosis is opposite to that of diffusion. The surface tension in intestinal lumen between fat droplets and aqueous medium is decreased by bile salts. The surface tension in intestinal lumen between fat droplets and aqueous medium is decreased by bile salts. Which of the following is located on mitochondria? Mitochondria has all of above as cytochrome oxidase, succinate dehydrogenase, and dihydrolipoyl dehydrogenase. They all are present in mitochondria: cytochrome oxidase, succinate dehydrogenase, and dihydrolipoyl dehydrogenase. The most active site of protein synthesis is the ribosomes. The fatty acid can be transported into and out of the mitochondria through facilitated transfer. Mitochondrial DNA is circular double-stranded. Livestock management quiz. First ruminant to be domesticated was goat. Age at first calving in cattle in ideal conditions should be 12 to 24 months. Which of the following breed of buffalo is named after a local tribe? Aziz Kheli. Which of the following characters are kept in mind while selecting an animal, excluding long service period? The characteristics that are kept in mind while selecting an animal are: attain maturity at early age, more production per lactation, short dry period, and better FCR. It should not have a long service period. All are the housing systems for dairy cattle except battery system. The systems of cattle housing are freestall, head-to-head system, loose housing system, and tail-to-tail system. Battery system is of poultry. The only recommended type of housing system for successful dairy farming is freestall. Which of the following is a type of fish-borne milking parlor? It is A and B. Herringbone and parabone is a type of fish-borne milking parlor. Herringbone and parabone. Secretions from the udder of dairy animals for 1 day after calving is termed as colostrum milk. Vaccination of brucellosis in calves should be done at the age of 4 to 7 months. Most widely used means of identifying dairy animals: ear tags. Ear tag is the most widely used means for identifying dairy animals. Feeding with a weight of feed or ingredient including moisture is known as fed basis. As fed basis is the feeding with weight of feed or ingredient including moisture. At fed basis, the number of percentage of calves produced within a herd in a given year relative to number of cows or heifers exposed to breeding is calf crop. Calf crop is the crop of calves or the total calves produced within a herd in given year relative to the number of cows that were bred. An estimate of the percentage of salable meat muscles from a carcass versus percentage of waste fat is cutability or cuttability. Cuttability is the ratio of meat to fat in carcass. A young chicken produced for meat is a broiler. Keeping an animal within buildings, corrals, or pens during all stages of production is termed as confinement. All are examples of red meat except broiler. And the red meats are beef, veal, pork, mutton. They are all the red meats: beef, veal, pork and mutton. Broiler is a white meat. High volume, high level of nutrients as compared to calorie content is known as nutrient density. Nutrient density is the high level of nutrients as compared to calorie count. Failure to reduce concentrates in stables horses fed on days when it is not exercise can lead to azoturia. Failure to reduce concentrates in stables horse feed on days when it is not exercised can lead to azoturia. The wolf teeth are known as bridle teeth. Wolf teeth are the bridle teeth. True of camel breeding is seasonal breeder. Camels are seasonal breeder. A characteristic feature of rutting male is restlessness. Restlessness is a characteristic feature of rutting male. Monitoring for all existing and incoming animals for diseases and use of disease prevention technique is known as biosecurity. Biosecurity is the monitoring of all existing and incoming animals for disease and use of disease prevention techniques. Which machine or what machine is used to determine if water has been added to milk? It is the cryoscope. With cryoscopy, we determine if the water has been added to milk or not. The only aspect of milk quality that can be completely controlled on farm is drug residue content. Drug residue content is the only aspect of milk quality that can be completely controlled on the farm. And fat, protein, carotene, these factors are the aspects of milk quality that cannot be controlled on the farm because it has involvement of genetics. Fat, protein and carotene cannot be controlled on their quality cannot be controlled within the milk, but the factor that can be controlled on the farm is the drug residue content aspect of milk. Zoonotic diseases refers to that transmits both B and C, animal to human and human to animal. Any diseases that are transferred from animal to human or human to animal are the zoonotic disease. Livestock production mostly affected by fodder scarcity. Fodder scarcity affects livestock production. How to control increasing prices of meat in Pakistan? It can be controlled by control of illegal export. Control of illegal export can lead to control increasing prices of meat in Pakistan. Largest Landhi dairy cattle or Landhi dairy cattle mostly consists of buffalo. Largest Landhi dairy cattle colony, it is in Sindh, I think in Karachi. Largest Landhi dairy colony mostly constitutes of buffalo. Which of the following has a greater effect on farmer for choice of marketing channels? Level of education. Level of education greatly affects on farmer for choice of marketing channels. Animal breeding and genetics. Two animals having an ancestor is known as collateral relationship. Collateral relationship are two animals having an ancestor in common. If the relationship of two parents is not known, then inbreeding coefficient of their offspring is 0. 0 will be the inbreeding coefficient of their offspring if the relationship of the parents is not known. Frequency of heterozygotes is decreased by inbreeding. Inbreeding decreases the frequency of heterozygosity. Mating of related individuals is inbreeding. The definition of inbreeding, it is the mating of related individuals. Decrease in productive and reproductive performance of inbreeding animals is inbreeding depression. Inbreeding depression is the decrease in productive and reproductive performance of inbreeding animal. It is the inbreeding depression. Group of relatives in dam family are full sibs. Full sibs are the group of relatives in dam family. Selection based on ancestor performance is pedigree selection. Pedigree selection is the selection based on ancestor performance. Natural selection and genotype by environmental interaction in 1800s by Charles Darwin. In 1800s or the 17th century, Charles Darwin proposed natural selection and genotype by environmental interaction. In DNA replication, the strand synthesized continuously is the leading strand. Lagging strand is not continuous and it is in fragments known as the Okazaki fragments. Hybrid vigor determines the complementarity. Complementarity is determined by hybrid vigor, or hybrid vigor determines complementarity. When a purine replaces an other pyrimidine, then it is transverse mutation. The replacement of purine with pyrimidine is transverse mutation. Cell division that produces gametes which contain the haploid number of chromosomes is meiosis. Meiosis produces the haploid chromosomes. Location on a chromosome where a particular gene is found is a locus. Gene whose effect masks the phenotypic expression of its allele is dominant. Dominance, the definition of dominance is the gene whose effect masks the phenotypic expression of its allele is the dominant. Dominant gene is the gene whose effects masks the phenotypic effects of its allele. Both genes at a particular location are the same allele homozygous. Both genes at particular location are the same allele homozygous. Animal nutrition. The swallowed of chewed feed, also known as deglutition. Deglutition is the technical term for the swallowing of chewed feed. Deglutition. Species entirely dependent on plant for food are classified as herbivores. Food given to the animals, including plant cuts, are carried to them is fodder. Fodder is the food given to the animals, including plant cuts, is fodder. Ruminants are polygastric. Total number of taste buds in cattle are almost 25,000. 25,000 are the total number of taste buds in cattle. Finger-like projections on tongue that contain taste buds are papillae. Papillae are the finger-like projections on tongue that contain taste buds. Structure that prevent food to enter into lungs is epiglottis. Epiglottis prevents food to enter into the lungs. Esophageal pouch in poultry is crop. Crop is the esophageal pouch in poultry. Which of the following deficiency contribute to paralysis in poultry? Manganese or Mn, its deficiency contributes to cirrhosis in poultry. Animal with single stomach which swallows feed after chewing does not regurgitate is horse. Horse is the animal with single stomach which swallows the food after chewing and does not regurgitate. Lipid content of feed is determined by ether extraction. Ether extraction determines the lipid content. 1 gram of nitrogen is associated with 6.25 gram of protein. 6.2 gram of protein is associated with 1 gram of nitrogen. All are fat soluble except vitamin B. Moisture or measure of ratio of feed mass into increased body mass is FCR. FCR is the measure of ratio of feed mass into increased body mass. In ruminants, maximum absorption of volatile fatty acids occur in rumen. In rumen, there is the maximal absorption of volatile fatty acids. Which one is not digested in rumen? Lignin. Main absorption site for most of the breakdown products of animal feeds is small intestine. It is the main absorption site for most of breakdown products of animal feed. All functions of large intestine except secretion of bile. Large intestine is involved in the storage of excreta, electrolyte balance, absorption of minerals, and some microbial fermentation. Large intestine has storage of excreta, electrolyte balance, absorption of minerals, some microbial fermentation, but large intestine do not secrete bile. Saliva is rich source of phosphorus and bicarbonate. Veterinary anatomy. Choose the exocrine gland. Liver is exocrine gland. Which cartilage is located in intervertebral disc? Fibrocartilage is present in intervertebral disc. Choose the yellow connective tissue. Ligament flava is a yellow connective tissue. Which one supports the head? Ligament nuchae or supports the head. Gastrointestinal tract, excretory ducts of gland, gallbladder are made up of simple columnar epithelium. Simple columnar epithelium lines the gastrointestinal tract, excretory ducts of gland and gallbladders, and simple squamous epithelium lines the circulatory system and capillaries. Simple cuboidal epithelium is present in oviduct. Oviduct has a simple cuboidal epithelium, and simple columnar epithelium is in gastrointestinal tract, excretory ducts of gland, gallbladders, and oviduct has simple cuboidal epithelium. Which one is not intended to be the function of skeleton? Reproduction is not the function of skeleton. Elastic cartilage is found in external ear. External ear has elastic cartilage. Os cordis is present in the heart of cow. Cow has os cordis, and os penis is present in dog. Penis of dog has os penis. Snout of pig consists of os rostri. Os rostri is in the snout of pig. Os penis is found in dog. Axial skeleton consists of sternum. Consists of all of above, as vertebral column, head, ribs, and all these consist of axial skeleton. Splanchnology is the study of abdominal viscera. Abdominal viscera deals with splanchnology is the study of abdominal viscera. Study of sensory system is known as the anesthesiology. Study of sensory systems like eyes is It is wrong. It is the aesthesiology. A-N, not A-N. It is aesthesiology. Aesthesiology is the study of sensory system like eyes, ears, etc. Simple squamous epithelium can be featured as all of above. Simple squamous epithelium can be featured as single layer of extremely thin flattened cells, thin nuclei found in Bowman's capsule, and it is found in also circulatory system. Found in Bowman's capsule and circulatory system, it has thin nuclei, single layer of extremely thin flattened cells. These are about simple squamous epithelium. Simple columnar epithelium are in gastrointestinal tract and gallbladder, and simple cuboidal epithelium, I forgot where was it. Which one is found in gallbladder, small and large intestine? Simple columnar epithelium is found in gallbladder, small and large intestine. Simple cuboidal epithelium is present in gallbladder, small and large intestine. Gallbladder has cuboidal epithelium. Cilia and goblet may be seen in stratified cuboidal epithelium. Stratified cuboidal epithelium lines the cilia and goblet cells. Which one of the following epithelium is found in respiratory region of nasal cavity, larynx and trachea? Respiratory system has pseudostratified columnar epithelium. Pseudostratified columnar epithelium and columnar epithelium was in digestive system, but respiratory system has pseudostratified epithelium and the organs as the nasal cavity, larynx and trachea. Parenchyma can be defined as all of above as sheets of closely opposed cells with scanty intercellular substance, secretory units and ducts which forms the compound glands, internal supportive framework, underlying connective tissue. But the correct answer of parenchyma is the secretory units and ducts which forms the compound glands. It is the definition or the point of parenchyma that it is the secretory units and ducts which forms the compound gland. Stratified squamous epithelium is found in both C and D as esophagus and rumen and reticulum. Esophagus, rumen and reticulum has stratified squamous epithelium. Stratified cuboidal epithelium, it is squamous epithelium. Stratified squamous epithelium is an esophagus and rumen and reticulum. Stratified cuboidal epithelium is in superficial cells, cuboidal in shape. Simple cuboidal epithelium. Stratified cuboidal epithelium is superficial cells and shape is cuboidal. Name indicates contracted and distended state is present in transitional epithelium and it is present in gallbladder. Contracted and distended state is present in transitional epithelium and it is present in gallbladder. Which one is found in ducts of glands? Stratified cuboidal epithelium is found in ducts of glands. Ducts of glands has stratified cuboidal epithelium. Which statement is true for mesothelium, both B and C, as it lines the cardiovascular system and lymphatic system and it is derived from mesoderm. Mesothelium is derived from mesoderm and it lines the cardiovascular lymphatic system. Which statement is true for simple coiled tubular glands? Simple coiled tubular glands have unbranched ducts. Secretory tube is uniform in diameter. Which statement is simple cuboidal tubular glands? Simple coiled tubular glands have unbranched ducts and simple coiled tubular glands secretory tube is uniform in diameter. They are unbranched and uniform in diameter. Zymogen granules are present in serous glands. Zymogen granules are present in serous glands. Mucigen droplets are found in serous glands. Serous glands has the mucigen droplets and the zymogen granules. Zymogen granules are and mucigen droplets both are in serous glands. Each chromosome contains the DNA content as 20%. 20%. Each chromosome contains the DNA content as 20%. Chromosome has 20% DNA. The study of karyotyping of chromosomes fall under cytogenetics. Cytogenetics is the study of karyotyping of chromosome. Karyotyping of chromosomes is known as cytogenetics. In heterozygous, one gene character is manifested in phenotype and such gene is known as dominant. In heterozygous, one gene character is manifested in phenotype and such gene is known as dominant. In karyotyping, colchicine is added in culture. In karyotyping, colchicine is added in culture for peripheral blood lymphocytes for arresting the cell division in metaphase. To arrest the cell division in metaphase, colchicine is added in the culture of peripheral blood lymphocytes. In heteroploidy, the chromosome number will be 3n in cells. In heteroploidy, the chromosome number will be 3n in cells. Veterinary anatomy quiz 2. Which one is present in ox but absent in sheep? Spheroid sinus. Spheroid sinus is present in ox but absent in sheep. Major nerve supplied to bovine horn is derived from cornual nerve. Cornual nerve is the major nerve that is supplied to horn. Horn is also known as the cornous process. Corneal artery is a branch of superficial temporal artery. Corneal nerve is the branch of superficial temporal artery. In oxes, for Peterson's eye block is deposited around orbitorotundum foramen. Orbitorotundum foramen is a foramen in which in oxes the Peterson eye block, the anesthetic analgesic is injected. Which one is present in ox but absent in sheep and goat? Facial artery. Facial artery is present in ox but absent in sheep and goat. Mullerian duct forms both B and C as cervix and vagina. Mullerian duct forms cervix and vagina. Study of abdominal and pelvic viscera is splanchnology. Viscera is the study known as splanchnology. Splanchnology is the study of viscera. Occipital myotomes. Occipital myotomes are origin of muscles of tongue. Occipital myotomes are the origin of muscles of tongue. Paramesonephric duct is known as Mullerian duct. Mullerian duct is another name of paramesonephric duct. Urogenital sinus give rise to vagina. Urogenital duct give rise to vagina. Bones having alveoli for teeth development in ruminants are both A and B as maxilla and mandible. Bones having alveoli for teeth development in ruminants are maxilla and mandible. Surface of teeth frequently used to determine ruminants is occlusal. Occlusal surface of teeth frequently used to determine the ruminants is occlusal. Blood vessels supplying the teeth of lower dental arcade in ruminants is inferior alveolar artery. Inferior alveolar artery is the vessel that supply teeth of lower dental arcade in ruminant. As inferior alveolar artery is supplied to the teeth of lower dental arcade in ruminants. Nerve supplying the teeth to upper dental arcade in or maxilla in ruminants is infraorbital nerve. Infraorbital nerve is supplied to the teeth of upper dental arcade. Lower dental arcade or lower dents and teeth are also all present within the mandible, and upper teeth are present on maxilla. The following cells are found in connective tissue except undifferentiated mesenchymal cells. Undifferentiated mesenchymal cells are not found in connective tissue, but the connective tissue may have mast cells, fat cells, and fibroblasts. Mast, fat, and fibroblasts may be present in connective tissue, but the connective tissue can never have undifferentiated mesenchymal cells. The following tissues are proper connective tissue. Adipose tissue is a proper connective tissue. Adipose tissue is a proper connective tissue. The loose connective tissue is found in all of above, as around mucous membrane of gut, between muscles, blood vessels, in the peritoneum and mesenteries. These are the parts for loose connective tissue. Loose connective tissue is found in around mucous membrane of gut, between muscles. Loose connective tissue is found between muscles. Loose connective tissue is found in blood vessels. Loose connective tissue is found in peritoneum and mesenteries. Or summary, loose connective tissue is found in around mucous membrane of gut, between muscles, blood vessels, and in peritoneum and mesenteries. Holocrine glands are present in mammary glands. Mammary gland has holocrine glands. Mesenchyma is a component of embryonic connective tissue. Mesenchyme is a component of embryonic connective tissue. Which one is true for macrophage abundant in sinusoid bone marrow? Macrophage is abundant in sinusoid bone marrow. Most active and numerous cells in regions of inflammation and abscess are macrophages. Macrophages are the most active and numerous cells in regions of inflammation and abscess. Chromatin of nucleus appears cat wheel-like in plasma cells. Chromatin of nucleus appears cat wheel-like in plasma cell. Single big vacuole in center is present in fat cell. Fat cell has a single big vacuole in the center. Which statement is true for mast cells? Mast cells have granules that contain heparin, histamine, and serotonin. Mast cells have granules containing heparin, histamine, and serotonin. All statements are true for plasma cells except that it is round shape, and round and shape is like symmetric. The truth about plasma cell is that the plasma cell chromatin of nucleus is cat wheel like. The plasma cell has chromatin whose nucleus is like cat wheel. The cytoplasm of plasma cell is highly basophilic. Plasma cell is ovoid or spherical cell. Plasma cell is the major producing of and circulating antibodies. Plasma cell produce circulatory antibodies. It is ovoid or spherical cells. Its cytoplasm is highly basophilic and chromatin of nucleus is cat wheel like. Pigment cells are found in skin. Skin has pigment cells that produce pigment cells are present in skin. Which statement is true for elastic fibers formed by fibroblasts in certain location of smooth muscles? It is for the elastic fibers. Elastic fibers are formed by fibroblasts in certain locations of smooth muscles, and we are talking about elastic fibers. Elastic fibers are formed by fibroblasts in certain locations of smooth muscles. Intersexes is a condition in animal which occur due to ambiguity in genitalia. Intersexes is a condition in animals which occurs due to ambiguity in genitalia. Internal syndrome may have karyotypes as X0 or X0. It is the karyotype of Turner syndrome. Turner syndrome has karyotype as X0 or X0. Mules have chromosome number as 63. 63 number of chromosomes are in mules. Bovine lymphosarcoma occur in animals having chromosome number of 61. Bovine lymphosarcoma occur in animal having chromosome number of 61. 63 is the chromosome number of mules. 61 is the number of bovine lymphosarcoma animals. Dogs with chromosome number 77 are more prone to lymphoma. Dogs with chromosome number 77 are more prone to lymphoma. And the bovine lymphosarcoma in animals mostly occur in chromosome having the chromosome 61. Veterinary medicine quiz 1. Hog cholera occurs in pig. Partial loss of epithelium on skin or mucous membrane is known as erosions. Erosion is the partial loss of epithelium on skin or mucous membrane. Burn area of skin and tissue remains sterile till 20 hours. Epidermis and dermis are destroyed, leading to shock in third degree burn. In third degree burn, epidermis and dermis are destroyed, leading to shock. Radiation affects the dividing cells of all of these, as ovaries, testes, and lymphocytes. They are affected by radiation. Leptospira is a spirochete spring-like bacteria. Leptospira is a spirochete which causes miscarriages in cattle. Coxiella burnetii is a rickettsia which causes Q fever in animals. Coxiella burnetii is a rickettsia which causes Q fever in animals. Ringworm is caused by fungi. Transmission of diseases from one generation to another is known as vertical transmission between generations. Aflatoxins are produced by all of above, as Aspergillus flavus, Aspergillus parasiticus, Penicillium puberum. They all forms the aflatoxins. Pesticides include all of above, as insecticide, rodenticide, and weedicide. Acetone, beta-hydroxybutyrate, and acetoacetate acids are known as ketone bodies that are formed by metabolism of lipids in case of deprivation of carbohydrate to any mammal. Prolonged starvation leads to atrophy of muscles. Deficiency of vitamin A causes pica. Pica causes the deficiency is caused by deficiency of vitamin A. Mucus containing cells in mucous membrane are known as goblet cells. Goblet cells are the mucus containing cells in numerous membranes. Mucin stains pink by hematoxylin and eosin staining. Hematoxylin and eosin staining stains mucin as pink. Sagospleen is observed in amyloid. Amyloid presents sagospleen. Epithelial pearl is an example of hyaline. Epithelial pearl is an example of hyaline. Ketosis in cows may cause fatty change. Fatty change may be due to ketosis in cows. Mucus degeneration in intestine is caused by all of above, as rotavirus, E. coli, and Ascaris. They cause mucus degeneration. Mucus degeneration in intestine is caused by rotavirus. Mucus degeneration in intestine is caused by E. coli. Mucus degeneration in intestine is caused by Ascaris, or summary. Mucus degeneration in intestine is caused by rotavirus, E. coli, and Ascaris. Corticosteroid therapy may lead to glycogen. Corticosteroid therapy may lead to glycogen. Amyloid occurs in the body as a result of immune complexes. Amyloid occurs in body as a result of immune complexes. In liquefactive necrosis, neutrophil cells are present. In liquefactive necrosis, neutrophils are present. Programmed cell death is known as apoptosis in living cells, or apoptosis. Apoptosis is the programmed cell death in living body. Botulinum cook in heat process to reduce population of botulinum cook is a heat process to reduce population of Clostridium species. Bovine encephalomyelitis is known as Bus disease. Bus disease is bovine encephalomyelitis. Bus disease, bovine encephalomyelitis. Epidemiological triad in disease causation refers to the balance between the host, the agent, and the environment. This is also the One Health. Epidemiological triad in disease causing refers to the balance between the host, agent, and the environment. Presumptive identification of unrecognized disease by application of tests, examination, or other procedures that can be applied rapidly is known as screening. Screening is defined as the presumptive identification of unrecognized disease by application of tests, examination, or other procedures that can apply rapidly is screening. Species or environment in which pathogen maintained and served is called as the vector. Species or environment in which a pathogen maintained and survived is called vector. Proportion of diseased animal in a proportion at given time is known as crude rate. Crude rate is the proportion of diseased animals in population at given time. And it is not sure. Attack rate for an epidemic disease is the same as prevalence. Prevalence is also the disease outbreak rate or the attack rate. Its prevalence. Polioencephalomalacia is associated with the deficiency of thiamine. Thiamine causes polioencephalomalacia or polioencephalomalacia. It is caused by thiamine. Trichomoniasis results embryonic death. Trichomonas fetus causes embryonic death, early embryonic mortality. Dust particle transmits saprophytes. Dust particle transmits saprophytes. Veterinary parasitology. Theileriosis is also known as East Coast fever. Theileriosis is the East Coast fever. Babesiosis is also known as all of above, as pyroplasmosis, Texas fever, and red water. Brownish coloration of fat is typical feature of babesiosis. Bulging eyes with swollen face is a typical sign of theileriosis. Bulging eyes and swollen face. Enlarged and mottled liver on necropsy is seen in babesiosis. Basnoidiosis. Basnoidiosis is a protozoal disease. Basnoidiosis is a protozoal disease. Inflammation of testes is commonly observed in basnoidiosis. The organism of basnoidiosis is related to genus Toxoplasma. Basnoidia. Basnoidy is the causative agent in cattle. Mechanical vector for basnoidiosis is tabnates. Babesiosis can be differentiated from all of above as anaplasmosis, trypanosomiasis, leptospirosis, and theileriosis. Pink hemorrhage on bovine brain is seen in babesiosis. Which of the following parasite can be transmitted transovarially? It is Babesia equi. It can be transmitted transovarially. Babesiosis is a common Babesiosis is mechanically transmitted by ticks. Hypoderma bovis infestation is usually seen in cattle. Larvae of Hypoderma bovis forms a breathing hole on skin. Paralysis of lower limb and legs if spinal cord is involved in hypoderma infestation. Which of the following is known as lung fluke? Dictyocalus viviparus is a lung fluke. Dictyocalus viviparus or lung fluke belongs to nematodes. Lung fluke or Dictyocalus viviparus is a nematode. Larvae of lungworm Dictyocalus viviparus become invasive in 3 to 7 days. Adult lungworms reside in 7 weeks. Adult lungworm resides 7 weeks in bronchi before termination of their life cycle. Adult lungworms reside 7 weeks in bronchi before termination of their life cycle. Mature lungworms reside in bronchi. Following are the ante-mortem findings for lungworms infestation except hematuria. Lungworm infestation has grunting sound, cyanosis and recumbency, nasal discharge, and rapid shallow breathing in lungworm, but lungworm do not have hematuria. Which of the following organ is condemned in Dictyocalus viviparus infestation? Lungs are discarded. The carcass should condemned if animal is emaciated and accompanied by pneumonia. If it is emaciated and has pneumonia, then the carcass is condemned. Lungworm infestation is also known as all of above as verminous pneumonia, verminous bronchitis, husk and hose. Husk, hose, verminous bronchitis, verminous pneumonia is the name of lungworm infestation, that is by Dictyocalus viviparus. Lungworm infestation can be differentiated from all of above as necrobacillosis, tuberculosis, hereditary disease, and actinobacillosis. Veterinary pathology. Which of the following disease has recreational exposure as means of spread to man? Brucellosis is a disease that has recreational exposure as means of spread to man. Anthrax is a bacterial disease. Which one is spread by ticks? Bartonella is spread by ticks. Which one is caused by ingestion of undercooked beef? Coliform infection. Coliform infection is caused by undercooked ground beef. Tularemia is Francicella. Tularemia is caused by Francicella. Francicella causes tularemia. Choose the rickettsial disease. Q fever is by rickettsia. Typhus is commonly seen in flying squirrel. Flying squirrel has typhus disease. Which one spreads via ingestion of raw or partially cooked infested freshwater fish? Clonorchis. Clonorchis causes the spread. Which one spreads via ingestion of raw or partially cooked infested freshwater fish? Clonorchis. Clonorchis is caused by an infected fish. Which one is contact zoonosis? Actinomycosis is contact zoonosis. Zoonotic disease. Bite of infected phlebotomous sandflies may spread leishmania. Bite of infected phlebotomous sandflies may spread leishmania. Fungal disease is nocardiosis. Nocardiosis is a fungal disease. African sleeping sickness is caused by bite of infected tsetse fly. Coenurus cerebralis is caused by Bartonella stodri. Which one is tapeworm of dog? Dipylidium is tapeworm of dog. African hemorrhagic fever is caused by Marburg virus. Which one is spread via occupational exposure? All of them as contagious. Ecthyma is spread by occupational exposure. Pseudococcus glanders, contagious ecthyma, their spread are occupational exposure. Contagious ecthymas, pseudococcus and glanders. Principal host of fasciolosis is water buffalo. Water buffalo is principal host of fasciolosis. Cattle is principal host of anthrax. The principal source of anthrax is cattle. Which one of the following is caused by a tapeworm? Bartonellosis is caused by a tapeworm. Tapeworm causes Bartonellosis. Ingestion of raw pork may result toxoplasmosis. Toxoplasma is caused by ingestion of raw milk, raw meat of pig. So toxoplasmosis, toxoplasma gondii. Botonius fever, BOTONNEUSE. Botonius fever is a zoonotic disease of dog by Rickettsia conuri. Rickettsia conuri causes disease in dogs as Botonius fever. Botonius is by Rickettsia conuri. Bovine encephal oomyelitis is also known as Bus disease. Bovine encephal or encephal oomyelitis is Bus disease. Bus disease, bovine encephal oomyelitis. Botulinum. Cook is a heat process to reduce the population of Clostridium botulinum. Clostridium botulinum, to kill Clostridium botulinum. Botulinum cook is a heat process to reduce this population of Clostridium botulinum. Stomach of poultry is proventriculus. Which one of the following acts as antioxidant in feed? Selenium is antioxidant. Factors responsible for anti-nutrition present in cottonseed cake is gossypol. Gossypol is in cottonseed cake. Castor oil has ricin, RICIN. Castor seed contain poisonous material naturally known as ricin, RICIN. Soya bean contains factor soin. Soybean contains SOYIN, soin, which is responsible for antitrypsin action. Soin of soya bean has antitrypsin action. The most active form of vitamin D is vitamin D3. Anti-hemorrhagic fever factor is vitamin K. Botonius fever is a zoonotic disease of dog. It is caused by Rickettsia conuri. Botonius fever is caused by Botonius fever of dog is by Rickettsia conuri. Botonius fever of dog by Rickettsia conuri. Bovine encephal oomyelitis is known as Bus disease. Bovine encephal oomyelitis is Bus disease. Botulinum cook is a heat process to reduce the population of Clostridium botulinum. Botulinum cook or 12D value reduces the population of Clostridium botulinum by a factor of 12 at 2.78 minutes for D121 degrees centigrade. Botulinum cook or 12D value. 12D value is also known as botulinum value. It reduces the population of Clostridium botulinum, or the botulinum cook reduces the value of Clostridium botulinum by a factor of 12, 2.78, 122.78 minutes for D121 degree centigrade. 122.78 minutes for 121 degrees centigrade. Inflammation of fat is known as steatitis, Statitis. Steatitis is inflammation of fat. Condensation of nuclear material into dark round hemorrhagic mass smaller than normal nucleus is pycnosis. Abnormally developed tissue is known as dysplasia. Veterinary pharmacology. What term is used to describe a more gradual decrease in responsiveness to a drug, taking days or weeks to develop? Tolerance. Tolerance is used to describe a more gradual decrease in responsiveness to a drug, taking days or weeks to develop. Tolerance is used to describe a more gradual decrease in responsiveness to a drug, taking days or weeks to develop. What term is used to describe tachyphylaxis? Tachyphylaxis. Tachyphylaxis describes a decrease in responsiveness to a drug which develops in a few minutes. Tachyphylaxis. Tachyphylaxis describes a decrease in responsiveness to a drug which develops in few minutes. Tachyphylaxis. Tachyphylaxis describes a decrease in responsiveness to a drug which develops in few minutes. And increase metabolic degradation. Toxic and drug resistance can be consequence of increased metabolic degradation. Tolerance and drug resistance can be by increased metabolic degradation. Tolerance develops because of none of above. The situation when failure to continue administration of a drug results in serious psychological and somatic disturbances is called abstinence syndrome. Abstinence syndrome. Abstinence syndrome is when failure to continue administering a drug that results in serious psychological and somatic disturbances as abstinence syndrome. The situation when failure to continue administering the drug results in abstinence syndrome. What phenomenon can occur in case of using a combination of drugs? Synergism can occur in case of using combination of drugs. If two drugs with the same effect taken together produce an effect that is equal in magnitude to the sum of the effects of the drug given individually is called additive effect. Additive effect will be the effect if two drugs with same effect taken together produce an effect that is equal in magnitude to the sum of the effect of the drugs given individually is the additive effect. Which of the following drugs is a 5-log inhibitor or 5-lipoxygenase inhibitor? All Xylotone, or name available as Ziflo or Xylotone. Xylotone or Ziflo is a 5-log inhibitor, 5-lipoxygenase inhibitor. Xylotone is a 5-lipoxygenase inhibitor. Which of the following drug is a leukotriene D4 receptor blocker? LTD4 blocker. Which of them is the leukotriene D4 blocker? Zafirlukast. Zafirlukast is a leukotriene D4 receptor blocker. Zafirlukast is a leukotriene D4 receptor blocker. Which of the histamine H1 antagonist is noted for serotonin blocking effect? Cyproheptadine. Cyproheptadine is which of histamine H1 antagonist? the histamine H1 antagonist as cyproheptadine is noted for the serotonin blocking effect. Cyproheptadine is a histamine H1 antagonist that is noted for serotonin blocking effect. Which of the histamine H1 antagonist is noted for ulcerogenic effect? Diazolline. Diazolline is an histamine H1 antagonist that causes ulcers, ulcerogenic effect. Diazolline has ulcerogenic effect and it is H1 antagonist. Side effect of first generation histamine H1 antagonists is sedation. H1 antagonists cause sedation. First generation H1 antagonists cause sedation. The immunosuppressive agent are all of above. The immunosuppressive agents are corticosteroids, cyclosporine, and tacrolimus or FK506. Tacrolimus, cyclosporine, and corticosteroids are immunosuppressive agents. Class of cyclosporine A is immunosuppressive agents. Cyclosporine A is immunosuppressive agent. Side effects of cyclosporine A is gastrointestinal disturbance. Cyclosporine A causes gastrointestinal disturbance. Cytotoxic agents are following. Cyclosporine is a cytotoxic agent. Cyclosporine is a cytotoxic agent. Cytotoxic agents are all of the following except cyclosporine is not a cytotoxic agent. Cytotoxic agents are azathioprine, leflunomide, and cyclophosphamide. Azathioprine, leflunomide, azathioprine, and cyclophosphamide are the cytotoxic agents. Cytotoxic agents are azathioprine, leflunomide, and cyclophosphamide. But the one that is not cytotoxic is cyclosporine. The side effects of interferon gamma is fatigue. Interferon gamma, the antiviral, causes fatigue. Exophthalmos is a feature of toxic goiter. Exophthalmos is a feature of toxic goiter. Acromegaly is caused by hyperpituitarism. Hyperpituitarism causes acromegaly, or acromegaly is caused by hyperpituitarism. Neuritis is observed in Meigs disease. Meigs disease has neuritis. Necrosis of brain is known as encephalomalacia. Removal of dead neurons through microglial cells is known as neurophagia. Neurophagia is the removal of dead cells through microglial cells. Increase in number of white blood cells in cerebrospinal fluid is termed as pleocytosis. Increase in number of white blood cells in cerebrospinal fluid is termed as pleocytosis. Pleocytosis is the term when there is increase in number of white blood cells in cerebrospinal fluid. Spongiform encephalopathy is called by prions. Which of the following belonging to second generation quinolones? Difloxacin. Difloxacin is a second generation quinolone. Difloxacin is a second generation quinolone. What is the drug rate of enrofloxacin in cattle? 2.5 mg per kg is the dose rate of enrofloxacin. It is available as an Ncure brand name in Pakistan. Ncure or enrofloxacin, the dose rate is 2.5 mg per kg in cattle. What is the dose rate of fluorphenicol in cattle? 20 mg per kg is the dose rate of fluorphenicol in cattle. The dose rate of fluorphenicol is 20 mg per kg and 2.5 mg per kg is of enrofloxacin. Enrofloxacin 2.5 mg per kg and 20 mg per kg is fluorphenicol. Which of the following drug is regarded as the first antibiotic of tetracycline group? Chlorotetracycline is regarded as the first antibiotic of tetracycline group. First antibiotic of tetracycline is the chlorotetracycline. Which of the following drug belong to short acting tetracycline group? The short duration of tetracycline group is oxytetracycline. Oxytetracycline is a short acting tetracycline group or tetracycline. Oxytetracycline is a short acting tetracycline. Which of the following was the first member of aminoglycoside antibiotics? Streptomycin was the first member of aminoglycosides. Streptomycin was the first aminoglycoside. First aminoglycoside was streptomycin. Ceftiofur is a third generation cephalosporin. Veterinary pharmacology. What does affinity mean? A measure of how tightly a drug binds to a receptor. Affinity measures how tightly a drug binds to a receptor. Target proteins which a drug molecule binds are all of above. Target proteins that a drug molecule binds can be receptor, ion channels, carriers, or any of them. Target protein binds receptors, ion channels, or carriers. If an agonist can produce maximal effects and has high efficacy, it is called full agonist. Full agonist is an agonist that can produce maximal effects and has high efficacy. Full agonist is an agonist that can produce maximal effects and has high efficacy. If an agonist produced submaximal effects and has moderate efficacy, it is called partial agonist. The substance binding to one receptor subtype as an agonist and to another as an antagonist is called as agonist antagonist. Agonist antagonist is a substance binding to one receptor subtype as an agonist and to another as antagonist. Irreversible interaction of an antagonist with a receptor is due to covalent bonds. Covalent bonds are irreversible. Which of the following is the second messenger of G protein coupled receptor? G protein receptor is metabotropic. Which of the following is the second messenger of G protein coupled receptor? CAMP, cyclic adenosine monophosphate, is the second messenger of G protein coupled receptor. Which of the following glucocorticoids have over one fluoride atom in its chemical structure? Triamcinolone. Triamcinolone is a glucocorticoid. Triamcinolone is a glucocorticoid and it has one fluoride atom in its chemical structure. Triamcinolone is a glucocorticoid having fluoride. Which of the following glucocorticoids have two fluoride atoms in its chemical structure? Fluocinolone. Fluocinolone has two fluorides and triamcinolone has two fluorides. Triamcinolone has one fluoride, two fluorides in fluocinolone. Do not confuse fluocinolone with triamcinolone. Triamci has one and fluoci has two fluorides. Which of the following glucocorticoids has no fluoride and it is prednisolone. Prednisolone has no fluoride, fluocinolone has 2 fluorides, and triamcinolone has 1 fluoride. Triamcinolone 1 fluoride, fluocinolone 2 fluorides, and no fluoride in prednisolone. Which of the following NSAID is propionic acid derivative? Ibuprofen. Ibuprofen is NSAID as propionic acid derivative. Ibuprofen is propionic acid derivative. Which of the following NSAID is pyrazolone derivative? Metamizole. Metamizole is pyrazole derivative. Metamizole is a pyrazole derivative, and ibuprofen is propionic acid derivative. Propionic acid derivative, ibuprofen. Ibuprofen is propionic acid derivative, and metamizole is a pyrazole derivative. And phentamate, not phentamate or fentanyl, that sort of is derivative. Meclofenamic acid is a phenamate derivative. Meclofenamic acid is a phentanate or phentamate. Phentamate is a meclofenamic acid derivative. Metamizole is a pyrazole derivative. Ibuprofen is propionic acid. Ibuprofen, propionic acid, metamizole, pyrazole, and meclofenamic acid, phenamate. And which one is the oxycam derivative? It is meloxicam. Pyroxicam is oxycam derivative. Is selective COX inhibitor. Which of the following NSAID is a selective COX inhibitor? Silicosib. Silicosib is a selective COX-2 inhibitor. Silicosib is selective COX inhibitor, and it is NSAID. Silicosib is an NSAID with COX-2 inhibitor. Which of the following NSAID is non-selective COX inhibitor? Pyroxicam is non-selective COX inhibitor. Pyroxicam is a non-selective COX inhibitor, and silicosib is a selective COX-2 inhibitor. Silicosib is a selective COX-2 inhibitor, and pyroxicam is a non-selective COX inhibitor. Side effects of indomethacin. Indomethacin includes all of above. Indomethacin induces abdominal pain, diarrhea, gastrointestinal hemorrhage, dizziness, confusion, and depression, and thrombocytopenia. These are the properties of indomethacin. Indomethacin has side effects as abdominal pain, diarrhea, gastrointestinal hemorrhage, dizziness, confusion, depression, and thrombocytopenia. We are talking about indomethacin. Goiter is related with A and B, hypothyroidism and hyperthyroidism. Otitis media is inflammation of middle ear, including tympanic cavity and eustachian tube. Otitis media is the inflammation of middle ear, including tympanic cavity and eustachian tube. Disturbance in equilibrium occur in animal with disease of inner ear. Glaucoma is caused by all of above as neoplasm, trauma, and hemorrhage. Glaucoma can be caused by neoplasm, trauma, and hemorrhage. Thalasia species worms may cause keratoconjunctivitis. Thalasia species worms can. Thalasia is an eye worm. Eyeworm nematode. Thalasia is a nematode that infects eyes, that inhibits eye, and it causes keratoconjunctivitis. Equine goiter is caused by iodine excess. Equine goiter is caused by iodine excess. Normally Iodine deficiency causes the goiter, but in equine, goiter is caused by iodine excess. Cleft in iris is known as coloboma. Cleft in iris is known as coloboma. Coloboma is the cleft of iris. Coloboma, cleft of iris. Ethambutol has the following unwanted effect. Ethambutol causes is the retrobulbar neuritis with red-green color blindness. Retrobulbar neuritis with red-green color blindness is caused by ethambutol. Ethambutol causes retrobulbar neuritis and red-green blindness. It affects the nervous system and the eyes. We are talking about ethambutol. Ethambutol infects nervous system and eyes, resulting retrobulbar neuritis and red-green blindness. Streptomycin has the following unwanted effect: ototoxicity and nephrotoxicity. Streptomycin is ototoxic and nephrotoxic. All the aminoglycosides are ototoxic and nephrotoxic. Which is the antibacterial drug? A nitronidazole derivative. It is a metronidazole. Which the antibacterial? A nitronidazole derivative. Metronidazole is a nitronidazole derivative. Metronidazole is a nitronidazole derivative. Metronidazole. Which of the following antibacterial drug is a quinolone derivative? Nalidixic acid. Nalidixic acid is a quinolone derivative. Quinolone derivative example is nalidixic acid. Which of the following antibacterial drug is a fluoroquinolone derivative? A fluoroquinolone derivative is ciprofloxacin. Ciprofloxacin is a fluoroquinolone, and quinolone is a nalidixic acid. Quinolone is a nalidixic acid and fluoroquinolone is ciprofloxacin, which is the unwanted effect of nitrofurans B and C. Nitrofurans can cause allergic reaction and hemolytic anemia. Nitrofurans cause allergic reaction and hemolytic anemia. The nitrofurans. What are the indications of fluoroquinolones? Fluoroquinolones are indicated for infections of urinary and respiratory tract and bacterial diarrhea. Fluoroquinolones are indicated for respiratory system, gastrointestinal system and urinary system, and especially the fluoroquinolone deals with urinary system and respiratory system and bacterial diarrhea. Fluoroquinolones. Theriogenology. The active form of testosterone in accessory sex glands is dihydrotestosterone. Dihydrotestosterone is the active form of testosterone in accessory sex glands. Which of the following is used as flushing medium for embryo collection? Dulbuco phosphate buffer saline. Dulbuco phosphate buffer saline is used as flushing medium for embryo collection. The Dulbuco phosphate buffer saline. The first successful embryo transfer was performed by Walter Heap. Walter Heap performed the first successful embryo transfer, and the first successful artificial insemination was in 1951. The first successful embryo transfer was by Walter Heap. And which of the following hormones are used for superovulation? Equine chorion gonadotropin for superovulation. Equine supergonadotropin superovulates. Superovulation is by equine chorion gonadotropin. The dose of pregnant mare serum gonadotropin for superovulation in cattle is 2000 to 3000 international unit. 2000 to 3000 international unit is the dose rate of Ppsc pregnant mare serum gonadotropin for superovulation in cattle. Following is disadvantage of pregnant mare serum gonadotropin. Long biological half-life is the disadvantage of pregnant mare serum gonadotropin, and its dose rate is 2000 to 3000 international unit in cattle for superovulation in cattle. But the disadvantage of pregnant mare serum gonadotropin is its long biological half-life. The total dose of follicle stimulating hormone for superovulation in large animal varies from 400 to 600 mg. FSH can be 400 to 600 mg for superovulation in large animals, and large biological half-life is of pregnant mare serum gonadotropin. 2000 to 3000 international unit is the dose rate of pregnant mare serum gonadotropin for superovulation in cattle, and equine chorion gonadotropin is used for superovulation. The pregnant mare serum gonadotropin is used at 2000 to 3000 international unit for superovulation in cattle, and this disadvantage of Ppsc is its long biological half-life. Total dose of follicle stimulating hormone for superovulation in large animals varies from 400 to 600 mg. The pH of flushing medium for embryo flushing should be 7.2 to 7.6. Slightly basic is the pH of flushing medium for embryo flushing. For embryo flushing, we need the medium of 7.2 to 7.6. The holding medium for embryo contains 0.4 BSA bovine serum albumin is at the ratio of 0.4% in holding medium for embryos, and 7.2 to 7.6 is the pH of flushing medium of embryos. 0.4% BSA is for holding medium of embryos, and the flushing medium for embryo flushing contains 0.1% BSA. 0.1% BSA in flushing medium and 0.4% bovine serum albumin in holding medium, and the pH of flushing medium should be 7.2 to 7.6. Holding medium contains 0.4% BSA and the flushing medium contains 4.1% BSA. Fish look vulva condition of female is intersex. Fish look vulva condition of female is intersex. Fish look vulva. The vulva shape is fish look like, and it is the intersex. Giemsa staining is used for acrosome reaction test. Giemsa stain is used for acrosome reaction test to check the acrosome reactivity. The staining is Giemsa staining. Which of the following antibiotic is routinely used? Tris diluter. Streptomycin sulfate is a routine tris diluter. The tris diluter and for an antibiotic is the streptomycin sulfate. Cytoplasm of sperm cell is located in mid-piece. Cytoplasm of sperm cells is located in mid-piece. Important question. Mid-piece has the cytoplasm in case of sperm cells. Optimum time to inseminate an Eve is towards end of estrus. Mare inseminated at end estrus. Mare is inseminated. Optimum time to inseminate swine is first or second day of estrus. At first or second day of estrus, swine is inseminated. At end of estrus, mare is inseminated. Optimum time to inseminate Eve is end of estrus. At end of estrus, Eve is inseminated and swine is inseminated at first or second day of estrus. Site of semen deposition in mare is uterus. At first or second day of estrus, swine is inseminated and towards end of estrus, Eve is inseminated and swine is inseminated at first to second day of estrus. Site of semen deposition in mare is uterus and cervix is, and the semen is deposited in cervix in cattle and buffalo. Approximate number of females which can be bred with an ejaculate of bull is 700. 700 females can be bred with an ejaculate of a bull. 700 females can be bred with an ejaculate of a bull. Liquid semen is of bull can be stored for 96 hours. Liquid semen is of bull. Liquid semen of bull can be stored for 96 hours. 48 means 2 days and 72 means 3 days. 4 days and 96 hours, I do not know the days, it will be 5 to 6 days. Can be 6 for 96 hours, 4 hours less than 100 hours. Liquid semen of bull can be stored for 96 hours, approximately 100 hours. Number of semen collections per week in a bull should ideally be 2 to 3. We can take 2 to 3 ejaculates from a bull per week. 2 to 3 ejaculates per bull per week. In goat, artificial insemination is done in the external os of cervix. External os of cervix is the place of insemination. In goats, the external os of cervix is the place of insemination. Post-estral bleeding is seen in cow. The ideal number of sperms per insemination should be 0.5 to 1 million. 0.5 approximately 1 million should be the ideal number of sperms per insemination. 0.5 to 1 million per insemination. The respiratory coefficient is lowest in semen of cock. Respiratory coefficient is lowest in semen of cock. The ideal intercalving period in crossbred cows should be 12 months. Barium chloride test for pregnancy diagnosis is not reliable in animals that fed primarily on pasture. Barium chloride test for pregnancy is not valid for animals who are fed primarily on pasture. Barium chloride test for pregnancy diagnosis is not reliable in animals that are on pasture. Pasture-fed animals has not valid barium chloride test results. Kuboni test is a chemical method of pregnancy diagnosis in mare. Mare can be diagnosed as pregnant or not by a Kuboni test. Kuboni test is chemical method for pregnancy diagnosis in mare. A hormone detected in a mare for pregnant mare, which can be used for pregnancy diagnosis by injecting into immature rat, is the equine chorion gonadotropin. Equine chorion gonadotropin is a hormone that is detected in blood of pregnant mare, which can be used for pregnancy diagnosis by injection into a mature rat. Equine chorion gonadotropin can be injected into rat to check that the mare is pregnant or not. Age of puberty in mare is 15 to 25 months, approximately 2 years. 2 years is the age of puberty of mare. and its gestation is of 12 months 12 days. In which species unfertilized ova is retained in the oviduct for several months? In equines, unfertilized ova is retained in the oviduct for several months. Equine can or mare can retain unfertilized ova for months. In which species prostaglandin secreted from uterus reaches ovary via general circulation? In equine, prostaglandin secreted from the uterus, the prostaglandin of uterus or uterine prostaglandin reaches ovary via general circulation. It's the property of equine that the prostaglandin secreted from uterus can reach ovary via general circulation. Enucleation of corpus luteum will not cause abortion in mare after 3 months. After 3 months, enucleation of corpus luteum will not cause abortion because thus there is another source of progesterone in female, that is the placenta. The placenta secretes progesterone that retains the pregnancy whether the corpus luteum is present in the ovary or not. So the enucleation of corpus luteum that is on the ovary will not cause abortion in mare after 3 months because of the presence of progesterone secretory organ, the placenta. Fetus of equine can be balloted at 100 days, approximately 3 months of pregnancy of equine. Its fetus can be balloted or palpated. Within the 3rd month of pregnancy of mare or 100 days of equine pregnancy, it can be palpated. Veterinary surgery. The cause of inflammation may be all of above, as mechanical, blow or sprain, physical, excessive cold or heat, chemicals as caustics, and bacterial. They all may be the causes of inflammation. The symptoms of inflammation include abnormal heat, swelling, redness, and pain. Termination of inflammation may be as deliscence, resolution, suppuration, and gangrene. The termination stage of inflammation, in which it suddenly subsides owing to its having been very slight, is deliscence. Deliscence is the termination stage of inflammation in which it suddenly subsides owing to its having been very slight. Deliscence is the termination stage of inflammation in which it suddenly subsides owing to its having very slight. The prognosis of inflammation depends on the nature, organ or part affected, and duration of inflammation. These are the factors from which prognosis of inflammation can be concluded, as the nature, organ or part affected, and duration of inflammation. Anodyne preparations such as cocainized Vaseline or iodoform ointment are indicated for very painful superficial lesions. Anodyne preparations such as cocainized Vaseline or iodoform ointment is used. The type of wound which have comparatively thick zone of dead tissue and are typical examples of contaminated wound are contused burns. Contused is the type of wound which has comparatively thick zone of dead tissue and are typical examples of contaminated wounds. Contused are the type of wounds which have comparatively thick zone of dead tissue and are typical examples of contaminated wounds. The most common site for frostbite in horses are lower parts of limbs. Lower parts of limbs are the most common sites for frostbites in horses. In affections of eye, antiseptic lotion such as boric acid can be used as 2 to 3%. In affection of eye, antiseptic lotion such as boric can be used as 2 to 3% boric acid. The condition, which is characterized by complete absence of eyeballs, although eyelids may be present, is called as anophthalmia. Abnormal protrusion of eye is known as exophthalmia. Retraction of the eyeball in the orbital cavity is known as exophthalmia. Retraction of eyeball in the orbital cavity is known as exophthalmia, and anophthalmia is the abnormal protrusion of eyeball. This should have to be confirmed that whether abnormal protrusion of eyeball is anophthalmia or not. I think it's exophthalmia. Exophthalmia should be, but not sure. Retraction of eyeball in the oral cavity, I think it is anophthalmia. The congenital anomaly, which is characterized by the presence of only one eye situated on the middle line of the head, is known as cyclopia. Cyclopia is the congenital anomaly which is characterized by the presence of only one eye situated on the midline of the head. Cyclopia. Non-perforating wounds of the eyeball involved both A and B as conjunctiva, cornea, and sclera. Non-perforating wounds of the eyeball involved conjunctiva, cornea, and sclera. Non-perforating wounds of eyeball involve conjunctiva, cornea, and sclera. Which of the following is regarded as commonest forms of conjunctivitis? Catarrhal. The common form of conjunctivitis is catarrhal. Catarrhal is the commonest form of conjunctivitis. Which of the following is seen in the dog and whose characteristic lesion is hypertrophy of lymphatic follicles? Follicular. Follicular is seen in the dog whose characteristic lesion is hypertrophy and lymphatic hypertrophy of the lymphatic follicles. Which of the following is seen in dog and whose characteristic lesion is the hypertrophy of the lymphatic follicles? Follicular. For anesthetic medication, dose rate of xylazine in bovine is 0.1 mg per kg. The dose rate of xylazine as it is not anesthetic, xylaz is analgesic. The dose rate of xylazine in bovine is 0.1 mg per kg analgesic. Action of xylazine may be antagonized by all of above as atropine, doxaprame, yohimbine, and tolazoline. Action of xylazine may be antagonized by atropine, doxaprame, yohimbine, and tolazoline. Atropine, doxaprame, yohimbine, and tolazoline. They are antagonizers of xylazine. Which of the following is regarded as long established sedative which is given orally? The long established sedative which is given orally is chloral hydrate. Chloral hydrate is the long established sedative that is given orally. Chloral hydrate. Yohimbine is regarded as a universal antidote of many anesthetic agents, and its dose rate is 0.2 mg per kg. 0.2 mg per kg body weight of yohimbine is regarded as a universal antidote for many anesthetics. The antidote of anesthetics, yohimbine has the dose rate of 0.2 mg per kg. Doxaprem acts by direct action on all of above. Doxaprem acts as on aortic chemoreceptors, carotid chemoreceptors, and medullary respiratory center. Doxaprem acts on aortic chemoreceptors, carotid chemoreceptors, and medullary respiratory center. The action of doxaprem is it acts on aortic chemoreceptors, carotid chemoreceptors, aortic mean it affects the circulatory system, medullary respiratory means it affects respiratory system, and carotid chemoreceptors, aortic carotid chemoreceptors, and medullary respiratory center. For intravenous administration, how much concentration of chloral hydrate can be used? 5% of chloral hydrate is used as IV administration. 5% of chloral hydrate intravascularly is used. Yohimbine antagonizes xylazine sedation by blocking central alpha-2 adrenergic receptors. Blocking central alpha-2 adrenergic receptors is the mechanism of action of yohimbine antagonizing. Yohimbine antagonizes xylazine sedation. If we have to antagonize the sedation that was by xylazine, then we will inject him the yohimbine, and the yohimbine mechanism of action is to block the central alpha-2 adrenergic receptors. Which of the following drug reduces quantity and increases viscosity of saliva? It is the atropine. Atropine reduces the quantity and increases viscosity of saliva. Atropine reduces quantity and increases viscosity of saliva. Which of the following refers to the regulation of X-ray beam by beam restricting devices to restrict it to the site of the part of patient under examination? Collimator. Collimator refers to the regulation of X-ray beam by beam restricting devices to restrict it to the site of the part of patient under examination. Collimator refers to the regulation of X-ray beam by beam restricting devices to restrict it to the site of part of the patient under examination. Collimator regulates X-ray beam by restricting devices to the specific part of the patient under examination. It is flat plate containing series of alternating strobes of radiodense lead and radiolucent interspacer material encased in a protective covering of thin aluminium grid. Grid is a flat plate containing series of alternating strobes of radiodense lead and radiolucent interspacer material encased in a protective covering of thin aluminium grid. Grid is a flat plate containing series of alternating strobes of radiodense lead and radiolucent interspacer material encased in protective covering of thin aluminium. Types of grids are parallel grid, crossed grid, focused grid, and moving grid. Types of grids are parallel grid, crossed grid, focused grid, and moving grid. Parallel, crossed, focused, moving. Parallel, crossed, focused, moving are the types of grids. Most commonly used collimator are all of above, as aperture diaphragm, cones and cylinders, variable aperture collimator. They are the types of commonly used collimator. Types of collimator are aperture diaphragm, cones and cylinders, variable aperture collimator. The protective gloves used by radiography should have at least 0.5 millimeter lead. The protective gloves used for radiography should have at least 0.5 millimeter lead. The average annual incidence of lameness in dairy cattle is 4.6%. The average annual incidence of lameness in dairy cow is 4 to 6%. 4 to 6% is the percentage of lameness in cows. How much percent of lame cattle are dairy breeds? 95% of lame cattle are dairy breeds, and 4 to 6% is the prevalence of lameness in dairy cattle. 4 to 6% on average. 5% is the incidence of lameness in dairy cattle, and the 95% of these 5% dairy cattle, that are in total prevalence 95%, lame cattle are dairy breeds. Economic losses which result from lameness are all of above. Reduces leads to reduced milk yield, weight loss, disposals, death and replacement cost, infertility, prolonged calving interval. Lameness can lead to reduced milk yield, weight loss, disposals, death and replacement cost, infertility, and prolonged calving interval. Weight loss due to lameness may be 10%. Weight loss due to lameness may be 10%. For example, if a cattle is of 300 kilogram, then it will lose 30 kilogram weight due to lameness, and a 500 kilogram animal may lose 50 kilogram weight by due to the lameness. Veterinary microbiology. The term immunization was coined by Edward Jenner. Edward Jenner termed immunization. First vaccine against fowl cholera was developed by Louis Pasteur. Louis Pasteur made first vaccine against fowl cholera, and Edward Jenner used term immunization. Immunization by Edward Jenner and first vaccine against fowl cholera by Louis Pasteur. Cell wall is present in all of above as bacteria, rickettsia and fungi. Acid fast stain was discovered by Ehrlich. Ehrlich discovered the acid fast stain. Immunization was coined by Edward Jenner, and fowl cholera vaccine was by Louis Pasteur. Acid fast stain was discovered by Ehrlich. Edward Jenner for the first time vaccinated against smallpox using cowpox vesicle. The cowpox vaccine was by Edward Jenner. Edward Jenner vaccinated against smallpox using cowpox. Who developed the aseptic technique? Joseph Lister. Joseph Lister developed aseptic technique. Who coined term vaccine? Vaccine was termed by Louis Pasteur. Pasteurization is also the term acknowledged to Louis Pasteur. Vaccine term was coined by Louis Pasteur. And another term, the immunization, was coined by Edward Jenner. fowl cholera vaccine by Louis Pasteur, and smallpox or was by cowpox by Edward Jenner. Edward Jenner made the cowpox vaccine and Louis Pasteur made the fowl cholera vaccine. Do not confuse these. And Ehrlich was the has made the acid fast staining. Edward Jenner made the cowpox vaccine. First aseptic technique was by Joseph Lister. Vaccine term was coined by also the was by Lister. Lister has two contributions. It has developed the aseptic technique and coined the term vaccine. And eukaryotic cell, which of the following is a eukaryotic cell? Fungi is a eukaryotic cell. Comma shaped bacteria is called as vibrio. Vibrio is a comma shaped bacteria. Spirochetes are spiral shaped bacteria. Example is Leptospira. Who is known as father of antiseptic surgery? Joseph Lister is the father of antiseptic surgery, as Joseph Lister has developed the aseptic technique. And there was another contribution other than that of development of aseptic technique, that Donok, and he is the father of antiseptic surgery. Joseph Lister is the father of antiseptic surgery. Robert Koch is known as father of bacteriology. Robert Koch is known as the father of bacteriology. Mechnikov discovered defensive mechanism of phagocytosis. Dash discovered the complement fixation test. Edward Jenner discovered complement and complement fixation test. E. coli is a coccobacillus. Several vertical divisions of coccus results streptococci. Several vertical divisions in a single direction, it results streptococci. Staphylococci is like a bunch of grapes. It is not the vertical division. It is a division through. It is through in all directions in 2D plane, maybe the 3D plane. But if it's only one directional or vertical division, then it will make a line of cocci or a strip of cocci known as the streptococci. Membrane bounded organelles are absent in all of above. Bacteria, virus, and virions are deprived of membrane bound organelles. Babes Ernst granules are A and B. They are reserved and polymetaphosphate. Babes Ernst granules, babies or babies Ernst granules or babes Ernst granules, they are polymetaphosphate and reserve. I do not know its explanation. Fluid mosaic model is model for cell membrane. Teichoic acid is present in both A and C, gram positive bacteria and acid fast bacteria. Teichoic acid is only absent in gram negative bacteria. Gram negative bacteria do not have teichoic acid, whereas the gram positive bacteria and acid fast bacteria have teichoic acid. Gram negative bacteria contains lipopolysaccharides. Gram negative bacteria has lipopolysaccharides, and gram positive bacteria along with acid fast bacteria has teichoic acid. And structural backbone of bacteria is carbon. Structural backbone of bacteria is carbon. Nucleotide is made up of vaccine against fowl cholera, rabies, anthrax was developed by Jenner. Concept of attenuation was given by that. Teichoic acid is present in gram positive bacteria and acid fast bacteria. Gram negative bacteria contains lipopolysaccharide. Structural backbone of bacteria is carbon. Growth rate of bacteria is 0 in lag phase. As the name indicates, growth rate of bacteria is zero in lag phase. Concept of attenuation was given by Louis Pasteur. Pasteur gave the concept of attenuation. Vaccine against fowl cholera, rabies, anthrax was first developed by Pasteur. Pasteur made vaccine against fowl cholera, rabies, and anthrax. Fowl cholera, rabies, and anthrax were by Pasteur. Acid agar solidifies at 45 degrees centigrade. 45 degrees centigrade is the temperature for solidification of agar. Nucleoside is made up of nitrogenous base and pentose sugar. Nucleoside is made up of nitrogenous base and pentose sugar. Nucleotide is made up of nucleoside and phosphate. It means that nucleotide will have the nitrogenous base, pentose sugar, and a phosphate. One thing that is more in a nucleotide than that of nucleoside is the phosphate. Nucleoside do not have phosphate, whereas nucleotide has phosphate. Nucleotide is composed of three things, nucleoside of two things. The two things from which nucleoside is composed are the nitrogenous base and the pentose sugar. Nitrogenous base and pentose sugar. If nitrogenous base plus pentose sugar has the phosphate, then it will be the nucleotide. Mutation type, which the additional thing is the remember that the additional thing is the phosphate. Nucleoside plus phosphate is equal to nucleotide. Nucleoside has nitrogenous base, pentose sugar. If phosphate is added, phosphate backbone is the backbone of DNA. If the DNA backbone as phosphate is added to a nucleoside, then it will be a nucleotide. Mutation type, which leads to non-production of viable progeny at test organism, is known as lethal mutation. Lethal mutation leads to non-production of viable progeny of a test organism. Mutation leads to non-production of viable progeny of test organism. The type of interaction observed when a cell are co-infected by two different viral mutants but liens in different genes is the complementation. Complementation is a type of interaction observed when a cell are co-infected by two different viral mutants but liens in different genes. It is known as the complementation interaction. Complementation interaction is observed when cells are co-infected by two different viral mutants but liens in different genes. A method in which total viral DNA is subjected to the action of restriction enzymes and broken down into many fragments is shotgun method. By shotgun method, total viral DNA is subjected to the action of restriction enzymes and is broken down into many fragments. By shotgun method, I am not sure about that, but according to that, by shotgun method, total viral DNA is subjected to the action of restriction enzymes and broken down into many fragments. A type of high frequency recombination. A type of high frequency recombination which occurs in two forms, that are reassortment and intermolecular interaction is reassortment. Reassortment is a type of high frequency combination. Reassortment is type of high frequency recombination which occurs in two forms. Reassortment occurs as the reassortment and intermolecular interaction. Reassortment is a type of frequency combination which occurs as a reassortment and intramolecular interaction, intramolecular, not intermolecular, intramolecular interaction, and reassortment is in the reassortment frequency recombination, and it is a high frequency recombination. Reassortment is a type of high frequency recombination that has two forms as reassortment and intramolecular interaction. The term vector in genetic engineering is used to refer to the agents such as all of above. Vector in genetic engineering, plasmids, bacteriophage, and viruses can be the vectors. Vectors of genetic engineering are the plasmids, bacteriophage, and viruses. It is a point mutation when it causes non-formation of a protein through production of a termination codon. Nonsense is a point mutation when it causes non-formation of a protein through production of termination codon. Nonsense mutation is a point mutation which causes non-formation of protein through production of termination codon. Nonsense mutation produces termination codon. It should be remembered that the nonsense mutation produces termination of codon and it causes non-formation of protein. Nonsense mutation produces termination codon that results in non-formation of protein. Replication of virus includes all of above: attachment, penetration, uncoating, and transportation. APUT, attachment, penetration, uncoating, transcription. These are the steps of replication of viruses: attachment, penetration, uncoating, transcription. Which of the following is mechanism of viral persistence? All of them can be the mechanism of viral persistence, as integration of viral genome, antigenic drift, localization in protected sites, and non-antigenic nature. Viral persistence can be by non-antigenic nature. Mechanism of viral persistence can be localization in protected sites. Mechanism of viral persistence can be antigenic drift. Mechanism of viral persistence can be integration of viral genome, or in summary, mechanism of viral persistence can be by integration of viral genome, antigenic drift, localization in protected sites, and non-antigenic nature. It is a point mutation which is the missense is a point mutation which leads to change in structure of protein through replacement of an amino acid. Remember that nonsense was point mutation that leads to non-production of protein, whereas missense mutation leads to change in structure of protein. Protein is made, but it is of different structure. Its structure is changed, its amino acid sequence is changed, but in nonsense there is no production of protein, and in missense mutation there is a change in structure of protein. Protein is made in missense, but it is of different amino acid sequence. And in a missense mutation there is change protein through replacement of an amino acid. Veterinary physiology quiz. Decrease in number of all components of leukocytes is known as panleukopenia. Panleukopenia is the decrease in number of all components of leukocytes, or all types of leukocytes, as basophil, eosinophil, neutrophil, as granulocytes, and agranulocytes as monocytes and lymphocytes. If all these cells, basophil, eosinophil, neutrophil, monocyte and lymphocytes, they are decreased in number, then the term will be the panleukopenia. Pesticides may cause all of above. as they can cause neutropenia, lymphopenia, and hypogammaglobulinemia. Pesticides can cause neutropenia, lymphopenia, and hypogammaglobulinemia. Depletion of lymphoid tissue from follicles of bursa is in Gumboro disease. In Gumboro disease, there is depletion of lymphoid tissue from follicles of bursa. Gumboro is also known as the infectious bursal disease, in which there is depletion of lymphoid tissue from follicles of bursa. Macrocytic monochromic anemia is large sized red blood cells. Large sized red blood cell means macrocytes, large cells are largely, and monochromic means that normal hemoglobin. The chrome or the color of red blood cell is by hemoglobin. Hemoglobin is normal and their size of red blood cell is larger, though it will be the macrocytic and monochromic anemia. Erythrocytes having minute dark spots are known as basophilic stippling. Basophilic stippling is on the erythrocytes having minute dark spots. Minute dark spotted erythrocyte means they have basophilic stippling. Nucleus is absent in case of mammalian erythrocytes. Avian erythrocytes have the nucleus, but mammalian erythrocytes has nucleus in earlier stages or developmental stage of the erythrocyte, but the mature erythrocyte do not have the nucleus. Felines or cats, there is the report of cats having the premature red blood cells in their circulation, so there may be an observation of premature red blood cells with nucleus on their blood smear, and it is normal that they may be infected, and the increase of red blood cell will be premature red blood cell will lead to the observation of red blood cells, premature red blood cells with nucleus. Correct statement about crystalline zinc regular insulin include all of the following except it can be administered orally. It cannot be administered orally. Correct statement about crystalline zinc includes all of them, but the crystalline zinc insulin cannot be administered per oral as it is denatured. Crystalline zinc insulin can never be administered orally. But the true things about crystalline zinc are that it can serve as a replacement therapy for juvenile onset diabetes. Crystalline zinc can serve as a replacement therapy for juvenile onset diabetes. Crystalline zinc insulin can be administered intravenously. Crystalline zinc insulin is a short-acting insulin, or in summary, crystalline zinc serves as a replacement therapy for juvenile onset diabetes, can be administered intravenously, and is short-acting. It is short-acting, administered intravenously, and serves as a replacement therapy for juvenile onset of diabetes. These are about crystalline zinc insulin. Which of the following oral hypoglycemic drugs they decrease the glycemic level, stimulates both synthesis and release of insulin from beta islet cells? Hypoglycemia means that they decrease the glucose level. Drugs stimulate both synthesis of insulin. Insulin is responsible to decrease the glucose level by denaturing the glucose and to let the glucose to be available to the cells for their metabolism. Which of the following oral hypoglycemic drug stimulates both synthesis and release of insulin from beta islet of pancreas? It is glibenclamide. Glibenclamide is an hypoglycemic drug. Glibenclamide is a hypoglycemic drug that stimulates synthesis and release of insulin. And it's definite that insulin is released from beta cells of islet of Langerhans of pancreas, and glucagon is secreted from the alpha cells of the islet alpha cells of the islets of Langerhans of the pancreas. But here we are talking about that glibenclamide is oral hypoglycemic drug. Glibenclamide is an oral hypoglycemic drug that synthesizes and releases insulin by the pancreas beta cells. The action of insulin is potentiated by biguanides. Biguanides potentiates the insulin, or biguanides the action of biguanide is to potentiate the insulin, or insulin is potentiated by biguanides. Which of the following biguanides potentiates the insulin? And glibenclamide are the hypoglycemic drug that synthesize and release insulin. The hypoglycemic drug glibenclamide synthesize and release the insulin, whereas the insulin is potentiated by biguanides. Biguanides cannot release the insulin. Remember that biguanides can potentiate the insulin, but they cannot synthesize or release. If the insulin is synthesizing, then biguanides can potentiate the release and synthesis, but biguanides cannot synthesize or starts the release of insulin. For synthesis and release of insulin, we will need glibenclamide. Glibenclamide can synthesize and release insulin, but if the insulin is already being synthesized and released, but it is less potent or suboptimal, then we can potentiate it, or we can make it to its optimal by the biguanides. Which of the following agent is or are most important hormonal antagonists of insulin in the body? All of above are the important hormonal antagonists of insulin, or simple insulin agonists are glucagon, adrenal steroids, and adrenaline. Which of the following agents are hormonal antagonists of insulin, or simply the insulin antagonists? Insulin antagonists are glucagon, adrenal steroids, and adrenaline. Adrenaline is also the insulin antagonist along with glucagon and adrenal steroids. Glucagon is obvious that it is secreted from alpha cells of the islets of Langerhans, and it is antagonist of insulin. But along with that, adrenaline and adrenal steroids are also the antagonists of insulin. Glucagon can be used in following situations except severe hyperglycemia. Glucagon is not used in severe hyperglycemia, but we can use glucagon in severe hypoglycemia, endocrine diagnosis, and beta blocker poisoning. Glucagon can be used in severe hypoglycemia. Glucagon can be used in severe endocrine diagnosis. Glucagon can be used in endocrine diagnosis, severe hypoglycemia, and beta blocker poisoning. If there is beta blocker poisoning, severe hypoglycemia, or endocrine diagnosis, glucagon can be used. Major complication of insulin therapy includes all of above as hypoglycemia, insulin allergy, and lipodystrophy at an injection site. Major complication of insulin therapy includes Hypo includes all of above as hypoglycemia, insulin allergy, and lipodystrophy at injection site. Insulin therapy complications: hypoglycemia, insulin allergy, and lipodystrophy at an injection site. The major synthetic estrogen are following: estradiol. Estradiol is the major synthetic estrogen. Diethylstilbestrol is also an estrogen, synthetic estrogen, is type of estrogen, but do not know that it is synthetic or not, but it is sure that estradiol is the synthetic estrogen according to this question, if it's not wrong. Indication of synthetic estrogens are following: indication of synthetic estrogens are for treatment of simple obesity, primary hormone post estrus. I do not show it, is for following except for treatment of simple obesity. Estrogens cannot treat obesity. Estrogen cannot treat obesity, but they can be used for primary hypogonadism, post-estrus hormonal therapy, and hormonal contraception. Estrogen or stilbestrol can be used in primary hypogonadism. Indication of synthetic estrogen are following: estrogen or diethylstilbestrol or stilbestrol or estradiol. Estradiol can be used in primary hypogonadism if there is the decreased reproductive size of reproductive organs, or suboptimal size or production or function of reproductive organs as primary hypogonadism. It can be used post estrus hormonal therapy. After estrus, we can the hormonal therapy used after the estrus also includes the estrogen. Hormonal contraception to avoid pregnancy or contraception, the estrogen is also used in that. It is used in primary hypogonadism, post estral hormonal therapy, and hormonal contraception. Tamoxifen. Tamoxifen is an anti-estrogen. Tamoxifen is an anti-estrogen, and in the body, estrogen is the function of estrogen are antagonized by progesterone, and whereas another salt against estrogen is tamoxifen. Tamoxifen is anti-estrogen. Progesterone is secreted by corpus luteum. The major content of phagosome is bacteria. The major content of phagosome is bacteria because phagosomes engulf or phagocytose the bacteria. So the major component of phagosome is bacteria. The platelets in blood are replaced about once every 10 days. After every 10 days, the platelets in bloods are replaced. The platelets in blood are replaced after every 10 days. The platelet formation rate per day per microliter of blood is 3000. The platelet formation rate per day per microliter is 3000. It means that 3000 platelets are formed every day in every microliter of blood, and the blood is made up of 1 liter of blood has 1000 microliters, and an average healthy man or has 6 liters of blood, or average 5 liters of blood, then 5000 microliters. And how much platelets will be formed every day in an animal or human of 5 liter blood will be the 5000 multiplied by 3000. 5000 multiplied by 3000, it will be the value for platelet formation per day per animal, but the platelet rate per day per microliter is the 3000 platelets per day per microliter of blood. Invading bacteria, viruses, and other injurious agents are destroyed by neutrophils and macrophages. Invading bacteria, viruses, or pathogens. Pathogens are destroyed by neutrophils and phagocytosis. By neutrophils are the first line of defense, and macrophages phagocytose these pathogens. The macrophages are the following cells. The macrophages are the monocytes fixed in tissues. The macrophages are the monocytes fixed in tissues. The spinal cord has anterior and posterior roots of single spinal nerve attached to single segment. Anterior and posterior roots of single spinal nerve. There is a single spinal nerve and it has the spinal anterior and posterior roots attached to a single segment. It means only it is a nerve with the anterior and posterior roots. It's the definition of spinal cord. Spinal cord is in simple a spinal nerve. It is a nerve. It is a spinal nerve that has the roots in anterior and posterior sides. Spinal cord is nothing except a nerve called as the spinal nerve that further roots the anteriorly and posteriorly. The midbrain has a cavity called the cerebral aqueduct. The midbrain has a cavity called cerebral aqueduct. Cerebral aqueduct is in midbrain, or midbrain has a cerebral aqueduct, or cerebral aqueduct is a cavity that is present in midbrain. The receptor for testes are modified epithelial cells. Modified epithelial cells are the receptors for taste. The receptors for taste are modified epithelial cells. The epithelium is modified, or the cells of the epithelium are modified, that results as the receptors for taste. Receptors of taste are the modification of an epithelium. Hormones are products of endocrine gland secretion. Then what will be called to the products of exocrine secretion? But according to that, hormones are the products of endocrine secretion. Which of the following endocrine drug is amino acid derivative? Thyroxine. Thyroxine is endocrine drug with amino acid derivative. Thyroxine is nature is of protein or amino acid derivation. Thyroxine is an amino acid and it is an endocrine drug or hormone. Thyroxine is an endocrine drug or endocrine hormone which composition is of amino acids. Which of the following endocrine drug is a peptide derivative? Peptide are also proteins, amino acids are also protein, but there is little bit difference between these two, as the peptides which of the amino acids composed to form peptides, and amino acids are a little bit simple than that of peptides. So here is asking about which one is the peptide derivative. Oxytocin is a peptide derivative. Oxytocin and thyroxine both are proteins in nature, but the thyroxine is amino acid derivative. And then look here that the amino acid derivative is thyroxine, whereas oxytocin is a peptide derivative. Which of the following endocrine drug is steroid derivative? Hydrocortisone, as the name cortisone or corticosteroid indicate that it should be steroid, so it is steroid. Endocrine drug is steroid derivative is hydrocortisone. Hydrocortisone is a steroid derivative. Hormone analogues are synthetic compounds which resemble the naturally occurring hormones. Synthetic compounds are which resemble naturally occurring hormones. Hormones analogues are the hormone resembling chemicals. Regarding the mechanism of action of hormones, indicate the false statement. The true statements of the that are regarded with the mechanism of hormones are that the false statement is hormones interact with specific receptors in walls of cells, and the true statement about the mechanism of action of hormones is that the cyclic adenosine monophosphate acts as a second messenger system. In the mechanism of action of hormones, cyclic AMP act as the second messenger statement, and in the mechanism of action of hormones, they stimulate adenylase cyclase enzyme. The hormones stimulate adenyl cyclase enzyme, and second messenger system is cyclic adenosine monophosphate. And another true statement is that many hormones owe their effect to primary actions on subcellular membrane. Many hormones owe their effect to primary actions on subcellular membrane, and they stimulate. Hormones stimulate adenyl cyclase enzyme, and cyclic adenosine monophosphate act as the second messenger system. They are all true about mechanism of hormones, and in a nutshell, cyclic adenosine monophosphate act as second messenger system. Hormones stimulate adenyl cyclase, and many hormones owe their effect to primary action on subcellular membrane. Which one is the heaviest particulate component of the cell? The heaviest particulate component of the cell is a nucleus. Cytoplasm is the most occupies the most space, but it is not heavy. The heavy compound or component is the nucleus. Which one is the largest particulate of cytoplasm? Largest particulate is mitochondria. Whether though they are in small sizes, but their number is very much, so they are the largest particulate of cytoplasm, and it varies from cell to cell. Some cells have many mitochondria, some cells have less mitochondria. I do not know that about which cells this MCQ is related about, but in general the largest particulate of cytoplasm is mitochondria. I am also not sure about that, whether it's true or not. The degenerative process are categorized. The degenerative process are categorized under the heading of catabolism. To break down is called the catabolism, and to make or to form the complex substances from simple as amino acid to protein is the anabolism, and to break the protein into amino acid or peptides is the catabolism, and the combination of catabolism and anabolism is the metabolism. So it is asking about degenerative process means that to make a simple things from protein to amino acids, and to from lipids to the fatty acids, so it is the catabolism as its degenerative process. Exchange of material takes place by A and B, diffusion and active transport. Exchange of material do not take place by pinocytosis. Pinocytosis means taking of water, and so I am not sure what is pinocytosis, but exchange of material takes place by diffusion and active transport. If energy is required, then it will be by active transport, or against the concentrated gradient will be by active transport, and through the concentrated gradient will be by diffusion, and diffusion do not require energy, but the active transport require energy, and both are the ways of exchange of material between cells. The average pH of urine is 6. Urine is acidic, little bit acidic, and its pH is 6. It also vary from animal to animal. Every animal has its own specific pH for urine, but generally the most of the animals have acidic urine. I think it's called asking about humans, and they had acidic urine and the pH is 6. The pH of blood is 7.4. Urine acidic is acidic. Urine is acidic. Blood is basic, little bit basic. Urine is acidic at 6. Blood is basic at 7.4. pH of blood is 7.4 when the ratio between carbonate and bicarbonate is 1:20. 1:20 is the ratio of carbonate and bicarbonate in blood when pH is 7.2, slightly basic, whereas the pH of urine is slightly acidic as the 6.